right, welcome back to Rohrich Knows, helping you become a better you. I'm Rohrich. I'm a plastic surgeon in Dallas, Texas, and today we're going to talk about a hot topic, microcoring. Now, what is microcoring? You may recall we had a podcast on YouTube channel broadcast about this several months ago with David Weir, who is my amazing nurse practitioner, and now we're fast forwarding and we've done over 100 cases, right? Yep. And it's amazing. So we're going to talk about what is microcoring, how does it work, and what are the results. And David's going to show some amazing results from our practice to see how it works, why it works, and the incredible upside to that and its other applications. So David, tell us about where we're at with the results of microcoring. And first of all, tell us what is microcoring.
Yeah, so we've had microcoring in the practice for over a year now. We're one of the first people in Texas, one of two that I know of that have it. And it's a fantastic device that actually causes microcores in the skin. So you're thinking of like a small punch biopsy in the skin. So tiny little holes that are produced in the skin using this device, and it's attached to a vacuum suction system, and that actually removes the skin. Right. So you can actually remove about 1 to 2 centimeters squared of the surface area of the skin, which is fantastic. Right. And we've never been able to do this before without surgery.
And without scarring.
And without scarring.
Right.
There is lots of safety data behind it on how much we can take before we have a risk for a scar. But when you think about aging, specifically the components of aging, the skin ages, the superficial, the deep fat ages, the muscle ages, and the bone ages. And we haven't really had anything significantly advanced in the skin aging category besides laser resurfacing, RF, et cetera, and that kind of middle part of the patient that might not quite be ready for surgery, or a patient who's had surgery 10, 15 years ago and is having some recurrent skin laxity. So Ellacor, the microcoring actually fits a really nice spectrum for that specific patient. When you look at the different modalities that have been out there before, we've been able to ablate the skin, which will cause tightening, absolutely. You can use radio frequency to do the same thing, but in safer and darker skins because you're ablating deep to superficial versus lasers are ablating superficial to deep. And then there's things like high frequency ultrasound that work more on the deeper collagen layers as well as the muscle layers in the SMAS to help tighten it there. But as far as superficial, Ellacor is just microcoring is a brand new type of way of thinking of how do we reduce the surface area of skin without causing scarring and limit the downtime.
The power of your own wound healing.
And without actually having to have surgery. So when they looked at this study in their safety studies, they looked at how much can you take before we cause a scar. And what they determined in the safety studies that if it's less than 400 microns or less than half of a millimeter wide, so we're talking tiny little holes in the skin, that you can actually, when the skin heals, you can be left with no scar, but skin reduction. Now, as far as histology is concerned, what's happening to the skin, obviously you're causing a mechanical injury. So you'll get neocollagenesis, thickening of the epidermis and dermis as the skin tightening. So it's kind of a trifecta of skin tightening and skin remodeling all at the same time. I don't want to say that I hate this term, but microneedling on steroids, but it kind of is.
Except you're taking the core out.
Yeah, but we're removing skin at the same time.
It's actually brilliant, and it was, actually invented by several of my colleagues at Harvard who are wonderful, and it's amazing. So what's the ideal patient? What is the ideal patient, David?
That is
now the real ideal patient, and
that has been my journey with Ellacor. Who I will treat, who I won't treat. Now, if someone comes in, this is the key part here. If you come into my office and you say, David, I want this, I'm going to say, you're going to have to see Dr. Rohrich. That's a facelift. There's nothing in the non-invasive or minimally invasive market that we can literally move an inch of skin. So that would be someone that I referred to you. So ideal patients I look at are patients that have static lines. If you have static lines, radial cheek lines, perioral lines, evidence that there is some skin laxity and some solar elastosis to the skin, these are great candidates because you could actually see improvement. I've had several patients come in their 20s or 30s and they want this quote-unquote snatched jawline, but they don't have any skin laxity. So if you're trying to go from on a scale of 0 to 10, 0 being terrible 10 being a 10 out of 10. If you're trying to go from a 10 to 11, it's impossible.
Right.
Okay, this is too invasive of a technology to do that. Now, if you're a 5 or 6 and you want to go to an 8 or 9, perfect.
Right.
If you're a 1 and you want to go to a 10, that's surgery.
That's surgery.
That's surgery. So,
Yeah.
I'm conservative. I tell patients over the course of several treatments, you should see on a good patient, about a 20 to 40% improvement.
With each session.
With each session.
Yeah.
And if you're wanting an 80 to 90% improvement, that's a surgical procedure.
Right.
That's not something that
Exactly.
we can do out of the OR. So I look at this patient, static lines periorally, and then static lines and obvious jowling to the
Right.
patient. This is a great patient. She's actually a fantastic patient for, I would consider, a fully ablative erbium laser and a facelift.
Right.
However, she did not want to have surgery.
Right, which is what a lot of people don't want.
Yeah, they said absolutely not going to have surgery. So this is an ideal patient for Ellacor. And I'll show you some of her before and afters coming up. So the treatment itself is very benign. You can see these 3 little needles attached to this device. They stamp in a specific pattern that we program at a depth that we program,
Right.
depending on the skin thickness. And we just want to make sure that we're getting those tiny little dots, those tiny little cores all over the skin.
With no overlap. Yeah.
With no overlap.
Very
'cause
important.
If you overlap, you can cause scarring. So
Right.
you could see my grid-like pattern is very tight with this patient. You could tell that there is no actual downtime, but it is impossible to hide. So
Of course.
I tell patients, it's like, for a good 7 to 10 days, there is no way that no one would not know that you had something done to your
Right.
face. Now, after about 3 or 4 days, you can apply a cosmetic to kind of cover up some of the
Right.
healing, but the first 3 days, there's definitely no way to hide it. But this is very representative of exactly what you look like during a treatment and immediately post a treatment.
Right.
You can see here again, immediate post-procedure. The patient on the left, I was a little less aggressive. The patient on the right, I was much more aggressive. And the reason why is the patient on the left didn't have a ton of skin laxity, so we're doing it more for skin remodeling, increasing collagen, increasing skin thickness. Whereas the patient on the right, we're really focusing on skin laxity, so the treatment aggressiveness is comparative to what we're trying to achieve.
And the FDA approval has been for skin wrinkles only. Off-label, you see both.
Yeah,
but
off-label you
the on-label has been for skin wrinkles only.
For
Which,
skin wrinkles.
but we use it every day for off-label.
Yeah. I mean, as soon as they give it to me, I'm like, okay, I'm going to do what you told me to do, and then I'm going to do what I want to do.
Right.
So this is very common of the healing journey. You can see what it looks like a day later, 2 days later, 3 days later, 4 days later. Even at this 4-day mark, this kind of residual redness to the skin. I've seen some patients that this redness is gone in 7 to 10 days. Kind of the average of my patients actually more closer to 4 to 6 weeks for it to
Right.
be completely gone. But it's not something that a light tinted moisturizer or something like that, a cosmetic, couldn't hide. And lighter, very light skin patients like Fitzpatrick 1s, I've seen this residual erythema, which is called post-inflammatory erythema, last 3 or 4 months. I mean, it just kind of depends on how well your skin heals after an injury.
Yeah.
And I
But
tell
that's
my
pretty uncommon to see. Is it?
no, I would say maybe 20% of my patients.
Yeah.
And I tell them, I say, if you get scratched or you cut your finger,
Yeah, you have a little
how long
redness.
is it red for?
Yeah.
I know they say, oh, it's red for months. Then I say, well, your skin's probably going to be red for months too, based on the way
Yeah.
your body heals. And then I have some patients that they say, oh, if I get a scratch, it's gone the next day. And those patients, typically with Ellacor, within 3 to 4 days, it doesn't look like they've had
Right.
anything done. But I'm much rather would like to set you up for the
Yeah.
longest journey of healing so you can expect it, and then you not have that long journey, and then it's a win.
Right.
Than to
Right,
say,
right.
oh, it's just no downtime facelift. You can return to work tomorrow.
Yeah, and it's not that. It's
That's
not a
what it
facelift,
is.
and it's not a
That's not what it
downtime. I know.
is. So.
I know.
Here are some of our patient results here. This is a fantastic patient for this. You can see she has jowling in the marionette line, as well as increased heaviness in the nasolabial fold. And then we did treat her neck off-label, and you can see fantastic improvement in her
Yeah.
skin laxity on her neck. If we look at the side view, now this isn't a facelift, but this is definitely improvement.
Yeah, you definitely can see the shaping.
Yeah, you can see the shaping. And to me, this looks like increased epidermal and dermal thickness and increase in collagen, which helps with the skin laxity and the kind of textural changes. And this is a great result. The patient was very happy with it. She didn't want to have a facelift. Is she a candidate for a facelift? Face and neck?
Absolutely.
Absolutely. She didn't want to have that done. So next best thing that we can offer would be the microcoring. Here's another one of my patients, a very mature patient, does not want surgery, has a significant amount of wrinkling in the lower face. So this is on label for microcoring, the wrinkle reduction in the lower face. I see a fantastic improvement with this. I think the skin looks better overall. The nasolabial folds improved. The oral commissure and jowl is improved. To me, this is a fantastic result.
Is this 1 or 2 treatments?
This is 1 treatment.
One
actually.
treatment?
Yeah,
Wow.
3 months
And
after
how
one
many
treatment.
weeks?
This would be 12 weeks
12
after.
weeks. That's amazing treatment.
Yeah,
I love. That's a fantastic.
Yeah, and it gets better. You know, when you injure the skin, it takes about a full 24 weeks or a full 6 months for to see the full effect. But around month 3 is when you see the majority of it. Here's another view of that. I mean, she's very happy with it.
Yeah, that looks phenomenal.
Yeah. Here's another one of my patients. I think we were doing something else to her neck. I'm trying to figure out what we did to her neck before treatment in her pre-photos, but see she has a big gnarly bruise there. You can see, look at perioral. We treated her very aggressive periorally, and then in the radial cheek lines are the lines that travel down the side of the face underneath the cheek. I have a fantastic improvement for her. Here's another view of that. I mean, you can see the obvious skin textural changes and great improvement. So, I mean, is she a candidate for a facelift? Absolutely. Did she want a facelift? No. So we said, okay, let's try this, something non-invasively. And you could see tangible evidence that she did have improvement, and she's very thrilled with these results.
Yep.
Here's another patient at baseline. This would have been 12 weeks after the first treatment and then 12 weeks after the second treatment. If I go to her side views, you can see kind of the progression of the skin tightening, especially in the jowl. If you look at the jowl compartment specifically and the skin laxity from baseline to after her second procedure, you can see a noticeable improvement in this. Now, she subsequently had a third procedure done, but I have not seen her in follow-up for that. So, but she's been thrilled with the results.
So you basically wait about 8 to 12 weeks, right? Initially, we said.
I do.
Just see how they're doing, because that's when you maximize wound healing.
Yeah, and also I like to spread it out. I'm very conservative in my approach. You know, sometimes I feel like we over-treat patients.
Right.
And if we would just give them a tincture of time, that's your word, a tincture of time. You know, a lot of times it might actually work itself out, and they might not need additional treatment. So even with my RF, now obviously looking at her from her baseline, I told her you're going to need several treatments.
Sure.
Like, I know you're going to need several treatments, but let's see how much impact we can make with just a single session, and that's why I like to push them out.
Yeah. No, I agree. I think it looks good. And I think the big thing that people asked us on my last podcast and on YouTube was that, okay, we like it, but I want to see long-term results. So now you're seeing long-term results. You've done over 100 patients. So tell me, you know, in summary, like, the 5 things you think people should know before they embark on this, but also, obviously, the training. We didn't talk about that. The training has to be done very intensely.
Yes.
One-on-one training, and of course, you've done 100, and we're in the process of publishing it. So, so give the viewers a summary of where do we go from here. I mean, I think it's actually, these results are so much better than from the FDA trial. Right. I think they look fantastic.
Yeah. No, I mean, to summarize in 5 things that you have to know. With Ellacor, it's only going to fix the structural laxity of the skin.
Right.
Okay. So we age from the bone, the fat compartments, the muscle, and the skin.
Right.
So I think this pairs perfectly with revolumization, with HA fillers, fat transfer, some of the biologic fat that we're using now. I think it's a great partner with that. But if you have a multimodal problem, you have to address it multimodally. So this is only addressing the skin laxity and the wrinkling. So when you pair it with other devices or other treatments, you can kind of get even better results synergistically. But again, I like to remind patients this only helps the skin. It doesn't help the volume that you lost at the same time. The other thing is that the healing is variable, and some patients heal very fast, some patients take a few weeks longer, and it's important as a provider that I set patients up for that, to let them know, okay? Because I don't want to say worst case scenario, but I want my patient to assume the longest healing journey versus the shortest healing journey. Because if you're thinking you can have it done and go to work, have it done on Friday, go to work on Monday. No. That's not what it is. That's not what it is.
I agree.
The other thing is it does not replace a surgical facelift. It just doesn't. Right. Okay. If you need a facelift and your expectations are to get that 80 to 90% improvement, That's a surgical procedure. I mean, the goal of anything we do in minimally invasive aesthetics is to prolong surgery, but we haven't come up with anything to indefinitely delay surgery or replace it.
Replace it.
Yeah,
No.
we haven't. So I think specifically, like I said, when a patient comes in and they grab their face and they pull it back an inch and they're like, oh, can it do this? And I immediately just say no.
No.
Like, no,
No,
that's surgery. You can't replace surgery right now.
I agree.
What else to take away from it?
The other thing I think is training. I mean, if you're going to do this, come visit someone like us, like David, who actually will show you how to do it correctly and properly, get you optimal results, having gone through that incredible learning curve. It's really an amazing technique and technology. You know why I like it? Because it's kind of a surgical way of looking at it.
Yeah.
And it was developed by surgeons, Jay Austin and at Mass General, one of my colleagues. And the other thing is, when I've done facelifts on people that have had this, it isn't like some of the other devices which really impair your ability to get into the plane. So I love it.
Yeah.
I love it. And it's a great adjunct because 70-80% of the patients we see don't want surgery. And that's why David is so busy in my practice.
That is true. But no, I agree. It doesn't replace surgery. It is working on a different pathway than some of the things that we're interfering with surgical-wise, like RF can cause, fibrolytic changes to the underneath the skin. Biostimulators, if done incorrectly, can cause these same kind of weird changes. This is specifically just focusing on the skin only, but it does have to be done by a qualified healthcare person that knows what they're doing. I mean, even as a nurse practitioner, I'm fully comfortable performing this procedure, but I was trained by a plastic surgeon, so I'm comfortable because of my knowledge and my wheelhouse of the way that I was brought up into aesthetics. This is not a procedure that I would delegate to anybody.
Oh, no.
I wouldn't get it done at the spa. This has to be done sterilely. This is even though it is minimally invasive, it is considered a surgical procedure, so it has to be done by someone qualified.
I think wise words. And the other thing is the ramifications outside the face are amazing. Arms, thighs, and we've done all that, and we're doing a lot of the clinical studies to actually show some other surprising effects on other parts of the body. So, stay tuned. Know before you go. Be educated. Find a healthcare provider that is an expert in this, and be safe. And this is another incredible arrow in our armamentarium that we can use to manage aging. And again, it's not a replacement for a facelift. So give us your comments, give us your thoughts, and we'll have you back next time again as we talk about this exciting new technology called microcoring by Cytrellis.